Hi, I am Dr. Amani Jambakar. I'm a fellowship-trained breast surgical oncologist, and it is October. It's Breast Cancer Awareness Month. So everybody get your mammogram, and we're here to talk about 5 of the most common myths I hear when people come into my office. So the first myth is that something that I did do or didn't do or ate or didn't eat caused my breast cancer. I have patients come to me all the time asking if their diet or the fact that they didn't exercise or they had kids later in life is the reason why they have breast cancer now. That's a total myth. Even though there are a few modifiable risk factors that we can control to decrease our risk, like having a healthy diet and exercising, most of the time breast cancer is just bad luck. 99% of cases have no cause, and it's just terrible luck, terrible timing. That's it. So the next myth that I hear all the time is that surgery is the cure for all different types of breast cancer. Even though patients come to me because I'm a surgeon, that doesn't mean that surgery is the right answer for every single person. For some patients, we will recommend chemotherapy before surgery. Doing chemo before surgery can have a lot of different benefits, including shrinking the tumor, so the surgery can be less when we do the surgery later on. Overall, surgery is usually a part of breast cancer care, but it isn't the first step for every single one. We're going to recommend the care that is going to prolong your life, and whatever the studies have shown us is going to help you live as long as possible is what we're going to recommend. So the next myth I hear all the time is that chemo is poison for the entire body. Patients come to me because they're refusing to start chemo because they say, I've seen your hair falls off, your nails fall off, I have permanent disability later, and they've seen all these kinds of side effects either on Facebook or Reddit or other forms of social media, or they've heard from someone in their family that they had chemo and they had terrible side effects. I'm here to tell you that I actually have had no patients complain of permanent side effects from chemotherapy. Chemo is poison, but it only impacts fast-growing cells in the body. That's why the hair falls out and the nails are affected, because these are fast-growing cells in the body. But because it impacts fast-growing cells, it also works really well on cancer cells. Additionally, we have all kinds of medication now to prevent the side effects of chemo before they even start. We have medication to take even if you feel a little bit nauseous. We have medication that's going to help your immune system stay strong. So a lot of the things that are depicted on social media or in the movies or on TV are not accurate anymore. There are many patients who are able to continue working through chemotherapy. So another myth I hear all the time is that mammograms don't detect cancer. Usually what happens is I'll be speaking with a patient and she'll have brought a female family member with her for the consultation. I'll then ask that female family member if she's gotten a mammogram, and she'll say, oh, well, mammograms don't really help pick up cancer anyways, right? So why would I do it? So that is a complete myth, and that is totally false. Mammograms have over 90% sensitivity in detecting cancer. They pick up calcifications very well, and they pick up cancers before they have a chance to become lumps that you feel in the breast. Mammograms are the most effective screening program that we have in the United States to pick up cancer early before it has a chance to spread to other places in the body. So if you're thinking, I'm not going to get a mammogram because it may not pick up my cancer anyways, the chance of that is very low. The chance is much greater that it will prove that your breasts are healthy or prove that you need further workup or a biopsy, one of those two options. So everyone get your mammograms. They do pick up cancers. They pick up cancers early, and getting a mammogram could potentially save your life. So the last myth that I hear all the time is, why get a mammogram? Because it's just more radiation. So a mammogram is only 0.4 millisieverts of radiation, which is about as much radiation as you would get from 7 weeks of just living in your home and walking around outside. You would get more radiation if you were living in a high altitude city such as Denver, just on a yearly basis, because the amount of radiation in the air increases every year. So the fact that a mammogram is too much radiation is just a myth. It's only a little bit more radiation than getting a chest x-ray, and it is perfectly safe to get a mammogram once a year. And no studies have ever shown that getting a mammogram once a year can cause radiation-related cancers later on in life. So if you're worried about radiation, don't live in high altitude cities. Don't take long cross-country flights where you're going to be at a high altitude. Check the radon in your home, but definitely get your mammogram.